OID.
Yeah.
Can't do this. What are we gonna do? We are gonna oblique the body, but make the head lateral. So, gonna turn this way, and then bring it nice and close. There, oblique body, lateral head. So, the three things we are looking for. Number one, IOML needs to be flat. It should be perpendicular to the front of your IR. So we need this IOML flat. Number two, IPL needs to be perpendicular to the IR. If it's not perpendicular, that means it's either tilted, right, or rotated. Okay? And then third, for me, MSP, make sure the MSP is straight and not tilting. Okay? So those are the three things that I recommend looking for here. I'm going to put on gloves now just to be safe.
Okay.
Okay. Because chances are you are going to need to touch the patient's head for this. It is possible to talk them into position, but it is difficult. Actually, you know what? I'm going to try, but chances are I'm going to need to use my hands. All right, so first of all, touch your ear to the board. Good. Do not touch the ear and cheek to the board. The head is slanted. If both of these are touching, your head is rotated. Only the ear should be touching, right? Because the cheek is narrower than where the ear is. Make sense? Okay, so ear touching. Good. Let's take a look. Actually, first of all, which lateral are we doing? Skull, facial bones, or sinuses?
Skull.
Skull, okay. So for the skull, we are going to need to change our collimation. Because if you look at the head is longer than it is tall. So we need to switch this to a 12 by 10. Okay, that's good for it. Great. Notice that I'm putting our central ray here, right where the EAM is. And we're going to be centering 2 inches above the EAM. So we're going to be centering right around here, 2 inches above the EAM. Notice we have cut off the chin, but we are focusing on the skull, the cranium, the upper part. We don't care about the chin. All right, so careful, I'm going to raise this up slightly. Good, you can touch again. All right. First things first, IOML. Okay, bring your chin down. Chin down. Good. Okay, so there's my IOML, right? Nice and flat.
Right.
Okay, now I come over here. I can see that my patient's head is tilted this way. So, crash course. So,
You want to join?
I need you to take the top of your head and turn it like this. And then just touch your ear. Oh, too far, go the other way. Good. Touch your ear. All right. All right. A little bit closer. And I'm sorry.
Judy is like, you're killing me.
So, top of the head just a tiny bit away, and then touch.
do is stick it in.
Good. Now notice when I was doing that, IOML, lift it back up a tiny bit. So bring your chin down just a little bit. Good. All right, rotation. I see chin here, ear there. Looks pretty good. Our tilt is just very slightly off. I'm gonna take the top of your head, just move it away a little bit more. Chin down. Good. Touch. All right. So if you come over right now, before she moves, let's take a look. Are we good?
Yeah.
Almost there. Chin down just a tiny bit. Tiny bit. Good. And that is our lateral positioning. Right, so no tilt, no rotation,
No
and then
OID.
chin down. Minimum OID.
Minimum. We
Right?
still have a little bit.
So some patients will have some OID, but remember positioning is more important than OID.
Okay.
It's okay to have some OID as long as you have the perfect positioning.
Okay.
All right. And then notice we're still 2 inches above that EAM.
Is there a preference of like a left lateral, how we normally do for like a lateral chest, or is it just affected side?
Ideally, so by default we would do, oh sorry, relax.
Judy's like, you're killing me. like you're killing
Um,
me.
yeah, default you would do left lateral if there was no request. If they do